Good afternoon, Chair, honored delegates, ladies and gentlemen. It is an honor to be able to address you today. My name is DeLuca, and I am the founding president of Chronic Illness Advocacy and Awareness Group. Our organization has been working with the elected officials to help enact rational legislation that would ensure compassionate, patient-centered care for individuals living with chronic illnesses and incurable conditions. Despite efforts to combat the opioid crisis in the United States, we continue to see rises in the abuse of illicit opioids such as fentanyl. We at Chronic Illness Advocacy and Awareness Group feel the increase in overdoses can largely be attributed to policymakers and law enforcement's one-sided approach, which primarily focuses on restricting access to opioid analgesics. In the year 2019 alone, more than 500 laws have been proposed to combat the opioid crisis, largely focusing on restricting access to opioid medications. As a result, patients suffering from post-operative care and from chronic pain has increased, and they are finding themselves unable to access effective pain treatments. The failure to provide adequate pain control increases the chance patients will engage in at-risk behavior, jeopardizing their health and exposing themselves to illegal, illicit substances. Regulatory and policy changes are mandating healthcare providers to recommend non-pharmacological and self-management techniques in lieu of analgesic medications. As a result, there has been an increase in the number of individuals suffering in the post-operative care setting, as well as those living with chronic illnesses and conditions. The continual push to restrict access to legally prescribed medications as a means to lower the incidence of opioid exposure has been proven ineffective as the crisis continues. It is known that illicit fentanyl is driving this crisis. In order to contain the crisis, we must refocus our efforts, implement a new strategy, and make it a top priority as a nation to stop the flow of illicit drugs and to restore access in our medical practices. The regulatory focus on restricting access has harmed the public health and individualized patient care. Our elected officials need to recognize the importance of individualized, patient-centered care in order to achieve the dual goals of combating the overdose crisis and the crisis of untreated pain. Until the United States adopts a more balanced approach towards combating the overdose crisis, we will continue to see rises in both overdoses as well as suicides for individuals suffering from chronic illnesses and incurable conditions. And we, as a nation, can do better. I thank you.